Hello and welcome to Healthcare IT Today. I'm Colin Hung, and today I'm joined by Dr. Coffin, who is CTO and Professor at Medical College of Georgia, Department of Family Medicine. Dr. Coffin, welcome to the program and thank you for joining me today.
Yeah, thank you so much for having me on today's session.
So, Dr. Coffin, you recently presented at the MGMA conference, and your session was sort of around chronic care management and remote patient monitoring. Can you maybe give us a little overview or a little insight into what you presented?
Yes, and what we decided is that our most vulnerable patients are our Medicare beneficiaries. And as of a few years ago, Medicare, especially for Medicare beneficiaries that have Part B, they will pay for what's called chronic care management. So any Medicare beneficiary that has 2 or more chronic medical conditions, they can enroll in what's called chronic care management. And what that means is that outside of their visit with their primary care doctor, we have a team of professionals that reaches out to talk with the patient at least 20 minutes a month. And Medicare will reimburse for that chronic care management service. And what happens is we have RNs, we have LPNs, we have CMAs, and what happens is they will reach out for 20 minutes a month and they will discuss the patient's medications. They will counsel patients on their chronic conditions, whether that be diabetes, COPD, congestive heart failure. And then they'll ask them, are you taking your medications? Are you taking them on a consistent basis? And then if you can also partner that with what's called remote patient monitoring, what happens is patients are sent home with equipment. So they're sent home with a glucometer, a scale, a pulse ox, a blood pressure cuff, and then that can link into their medical record. And what happens is with those 2 services, you can actually download the app, and let's say it's your parents or your grandparents. With that app, you can see what is their weight, what is their blood pressure, what is their glucometer, and then if they fall within the green section, you know that they're doing well, that their vitals are well, and that there's nothing else that needs to be done. But if that comes across as red, you know that someone from the healthcare team is reaching out to them. And we at Augusta University, we read about chronic care management, remote patient monitoring, and we sat down and said, do we have the infrastructure, the platform, and the personnel to make this happen? And at the time, we did not. So we looked at who we could partner with as far as a third-party vendor to help us with this. And when we reached out, we partnered with NavCare. And so NavCare is the platform that we use. They're able to upload that information into our electronic medical record. And then as a primary care doctor, I sign those care summaries once a month that they're able to spend greater than 20 minutes with the patient. Again, that's reaching out, that's making sure that they're taking their medications. If they don't have follow-up appointments, they'll make sure that those follow-up appointments are there. And then if patients need durable medical equipment or transportation, they're helping them with those things as well.
So first of all, that's amazing that you've adopted remote patient monitoring and you're early on in being a pioneer in that area. This NavCare app, is that an app that the patients download and use and enter the information from all these devices into it, and that's how it works?
So make a long story short, my parents, who are 84 and 86, they at the time had flip phones. And so NavCare actually mailed out the equipment to them. And it's easy as opening up the box and hitting the on button. And then what happens is that the equipment is automatically connected with that. So my parents don't have diabetes, but they were able to get a pulse ox and a blood pressure cuff and a scale. So they enter in those vitals every day. And because I'm listed as their caregiver, and I'm going to show you the app as soon as I can open up my own phone. The app is as easy as this says right here, remote patient monitoring. And what I can do is I can click on that. And then this is actually my father's pulse ox and blood pressure. And as you can see, this was done on Wednesday, the 19th. If I click on the 20th, he hasn't entered in his vitals at this time. So what happens is if those vitals aren't uploaded by 1 o'clock Eastern Standard Time, I know someone from the care team is going to reach out to my parents. We see that you didn't enter in your vitals. Was there a reason for that? Or if I go back to May 19th, if those vitals were in the red, what happens is NavCare is reaching out to them. Did they take their medications that day? Had they eaten something with a lot of salt, therefore their blood pressure or their weight might have been up? And we have protocols built around certain conditions. So if they have congestive heart failure, if they gain more than 2 pounds, if they're on a diuretic, let's take an extra dose of diuretic. Let's repeat your weight tomorrow. If it still remains high, we want you to get in with your primary care doctor. But if the weight has come back into that normal range, they're just going to continue on with their present medication regimen. So what we've found is that with chronic care management and remote patient monitoring, we've actually been able to keep patients out of the emergency room, right? Because a lot of these patients, if they gain weight, they may have been short of breath, they didn't have anyone to reach out to, or they may have had a difficult time contacting their primary care provider, they would go on into the emergency room. So that prevents, they're called unavoidable ER visits. So we're trying to prevent those ER visits if we're able to. The second thing is preventing hospitalization. So if we can catch them before, you know, they've gained 5 pounds or 10 pounds and got into respiratory failure, you know, what we found is that by having our Medicare beneficiaries on chronic care management and partnering it with remote patient monitoring, we've been able to avoid ER visits and, you know, hospitalizations or readmissions within 30 days.
Wow, that's an incredible story. Lots to unpack there. Want to first just ask, you know, 80 plus years old, having no problems using this technology. I mean, it is literally that simple. They just click the on button and everything is working, and they just go ahead and enter information into and enter their vitals. Is that?
Right, that's exactly right. So as soon as they take their blood pressure, that's automatically uploaded. As soon as they put the pulse oximeter on their finger, it's automatically uploaded. They don't have to do anything other than hit the on button. And when everything's done, they hit the off button, and then they do it again the next day. And so, like I said, my parents up until about 3 months ago had flip phones, and my dad even has problems turning on the computer, but this was very simple, and we were very fortunate. NavCare actually, as soon as the equipment was there, they called my parents, and they actually spent about 45 minutes, and they explained how to use it, and they explained it 10 times over just so that my parents and sometimes for some of us, we need that re-education over and over and over. But they spent the time, they got the equipment set up, and my parents have been on this system now for almost a year. And again, it's just peace of mind in that they know that someone else is looking out for them. And this is a program that is 365 days out of the year, 24/7. So if they can't get a hold of me, they can call NavCare and someone will pick up the line 365, 24/7.
Yeah, that actually, so first of all, that's amazing. They've made it that simple, and then they've addressed the last mile issue of, you know, teaching people how to use the equipment once it arrives on site. So that's fantastic. You just touched on a topic that I was going to ask next, which is the peace of mind aspect. You know, you as the caregiver, or as a member of the family, but how much peace of mind are you getting from just seeing this data, or just knowing that they're doing this on a daily basis?
So and my parents, for the most part, are fairly healthy, but I will say that for some of our patients that do have congestive heart failure or diabetes, that their caregivers are able to look at that app, knowing what their blood sugars are, what their weight is, and knowing that if they fall out of the range, someone is going to be calling them and going over their medications. And it really does give you peace of mind, because you may be at work all day and not realize that this has happened until you check the app after work, but someone during the day has already notified them. So it really does give you peace of mind that outside of our traditional four walls, we have a care team that's helping us to take care of our most vulnerable population, which is our Medicare beneficiaries. And not only that, you know, there is some of our Medicare beneficiaries, they are not technologically advanced. And so it really is nice that they can reach out and pick up the phone and someone's able to talk them through that. The other part is, I'll be honest, as a primary care doctor, sometimes we have 15, 20-minute appointments to handle multiple comorbid conditions. On a daily basis, patients have diabetes, hypertension, hyperlipidemia, hypothyroidism, they have arthritis, osteoporosis. And so you're trying to reconcile their medications, but we may not be educating to the best of our ability. And sometimes patients get home and they're like, well, I'm on the green pill and the blue pill and the pink pill, but they don't know why they're taking those medications and what they're truly for. And so our care team will actually explain to them if they don't understand, well, you're taking this medication for this, and you're taking this medication for that. And it really does help empower the patient as well, because they know exactly what they're taking, why they need to take it, and why they need to be compliant with that medication.
Again, you've touched on something very interesting here. I think in the early days of remote patient monitoring, there was a concern about patient-generated data that was, created by the patient, or created from devices that the patient was using. It sounds like the NavCare system incorporates the data that's collected from those devices right into your EHR. Uh, is there, two questions here. Is there any sort of concern over the quality of that data? And then also, once that data is in the EHR, do you find that it's useful for you to know sort of that baseline or anything? Or
So what I will say is this, is that with the chronic care management, so that's the first part that we did, is that at the end of the month we would receive a care summary of everything that happened with the patient. For those that have remote patient monitoring associated with it, that's when their vitals are being uploaded. Now, I'll be honest, at first our providers thought that they would be overwhelmed with the information coming in, but if you build protocols based off of that, so if they have congestive heart failure, I don't want to be contacted unless they gain greater than 3 pounds. And in that protocol, they are to take an additional dose of their diuretic. So we have a care team that's reaching out, making sure that those protocols are being followed, and that the provider necessarily is not being inundated with information that they may not necessarily need to handle because the care team is. But if it falls outside of the protocol, then they're letting us know that that's happening. So there was a concern, I'll be honest, with our providers thinking that they were going to be overwhelmed with information, but it has really shown us that we have been able to take better care of our patients because we have a care team that's helping us take care of them outside of their visits.
again, you're perfectly leading me on to my next set of questions here. And so really, it sounds like what this technology is allowing you to do is take care of your patients outside of the four walls of your office.
Yes, and I'll be honest, you don't have to be 65 to have Medicare. We actually have, much younger patients, 25, 30-year-olds that may have end-stage renal disease on dialysis, or unfortunately they may have a cancer. Or I have a patient that has orbital myositis and is essentially blind in both eyes, and so has difficulty with transportation. But he knows that if he needs anything, he can pick up the phone and call NavCare, and he can get a hold of me, or he can talk to any of the care team there, especially if he's worried about maybe his blood sugars or his blood pressure. Again, they have protocols there. If it falls outside of the protocol, they'll notify us. So it also gives the patient a peace of mind that, sometimes it is difficult to get into your primary care provider's office. I know accessibility can be difficult. Sometimes the phone systems don't work very well. But with NavCare, they pick, again, they're 24/7, 365.
Amazing, amazing. So I gotta ask this question. If there are other primary care docs listening to this, or executive directors at primary care practices that are sort of thinking about remote patient monitoring or doing this kind of thing, what advice would you give them?
Yeah, so, and I may have mentioned this at the MGMA conference. So main thing is sit down as a team, whatever that team may consist of. Do you have the platform to capture the data? Do you have the platform to capture the time that's associated with chronic care management and remote patient monitoring? And do you have the personnel to manage this? So those are the questions you need to ask yourself. Do we have the platform? Do we have the ability to calculate the time and do those care summaries? And do we have the personnel to help manage this? And if the answer is yes, then you need to look at a platform to be able to do that. If the answer is no, then that's where we went out and looked at third-party vendors that had already been established and were doing this, and then we partnered with them. So what I would say is this: it has really, number one, helped with reducing ER visits and avoiding hospitalizations and readmissions, but it's also increased our patient satisfaction scores for those patients because someone is reaching out to them. They feel as though, okay, there's a kind of a safety net there. If they can't get a hold of their provider, they can call NavCare. So it's really helped with our patient satisfaction and education of our patients regarding this. And so again, to me, it has been beneficial for our Medicare beneficiaries. The thing is, do you have the platform, the time, and the personnel to do this? And if not, there are vendors out there that are doing this and doing it successfully, NavCare being one of them.
Final question. Given that you've gone through this and you're kind of a pioneer in this area, what would you do differently? Is there anything that you've learned that said, oh, I would have done that, or maybe I would have included this in my project or in your rollout, anything like that?
Yes, and you'll have to forgive me. I believe that Medicare started reimbursing chronic care management either in 2016 or 17. So in all honesty, I wish we had started when it initially came out. But again, sometimes in healthcare, you wait to see how things kind of work out before you kind of jump into it. And so once there has been literature out there that shows that chronic care management reduces morbidity, mortality, reduces ER visits. So there is data and peer-reviewed articles out there that state that this can be done successful. It's just how do you start, and if you're unable to start, can you partner with someone who's done it successfully?
Amazing. Amazing. Well, Dr. Coffin, thank you so much for your time. We do appreciate it. I know you're practicing, so we do appreciate the time you spent with us on the program today.
No, thank you so much for having us.
This has been Colin Hung with Healthcare IT Today. Thanks for listening.